According to the CDC, Mississippi is one of 35 states currently facing a higher number of respiratory viruses than normal. They're calling it a quademic. WXXV News 25's Lucas Warren spoke with the local pharmacist to learn more about the viruses and ways to avoid them.
It always happens this time of year. The coughing, sniffling, and sneezing always seems to pop up around the office when the cold weather rolls in. We all know the usual suspects like the flu and the common cold, but newer respiratory viruses at large, like COVID-19 and norovirus, have introduced a new term, quademic.
Quademic refers to the flu, COVID, RSV, and the norovirus that is going around.
It's usual to see an uptick in respiratory viruses this time of year, but this year, Mississippi is seeing a higher amount of cases than usual.
I've definitely seen an uptick in prescriptions and patients being sick with the respiratory viruses that are mainly linked to one of the four of those viruses. What I have been seeing mainly is prescriptions for steroids, not really antibiotics because it's not really bacterial, it's more viral. And so a lot of the times if patients have more of the respiratory symptoms but don't test for flu or RSV, they're just mainly given maybe a steroid to reduce the inflammation or medications that help with the fever and the chills and nausea.
With infection numbers on the rise, this could put those who are vulnerable to these viruses at risk.
More of our immunocompromised communities and also the elderly, they're more susceptible to contracting these through the spread and being highly contagious, and children. So they put a lot of things in their mouth and their hand washing isn't as great as we would like.
So if you want to avoid catching the quademic this year, here are the best ways to do so.
Whenever I give recommendations, my number one thing is immune boosting. So taking things like zinc, vitamin C, elderberry. So doing that and building your immune system, as well as masking. So when you're in crowds, making sure that you're masking and doing what you can to try to prevent contracting any of those.
Like Dr. Butler said, the best way to stop the spread is by wearing a mask. However, if symptoms do persist beyond a couple of days, it is recommended to contact your local doctor. Until then, reporting in a mask, Lucas Warren, WXXV News 25.